Hello, everyone. I'm Jen Rumbalski, the director of the La Crosse County Health Department. And to start out with you on this Monday, July 6th, I wanted to share that in addition to being the director of the health department, I play a number of other roles in my life, as I'm sure you all do. If you work and you're a mom and a daughter and a granddaughter, perhaps, and a sister, and maybe a wife, or if you're on the other gender, you'd be the opposite, of course. But for me, I had a really fun mom moment this morning where the tooth fairy came overnight to see my 9-year-old, and his third tooth came out. It was his first front tooth. And so he was really excited. And he wrote a letter to the tooth fairy and asked the tooth fairy a whole bunch of questions like, are there more than one tooth fairy? What do your wings look like? If you colored your wings, how many colors would there be in there? And the tooth fairy wrote back and had this big long note. And when he woke up this morning and saw that letter from the tooth fairy, it was way more important than the couple of bucks that he got for his tooth. So that was pretty fun. So glad to be with you today. And I have hopefully some good news as well to share in regards to our case numbers. So I'm going to start with our case numbers from the weekend. On Friday, we had a total of 3, on Saturday, 7, and on Sunday, 12. So a total of 22 cases over a 3-day time period. Then today, so far, we have had 6 new cases. So those numbers are much lower than what we've seen in the past. We hope that that continues. I'm cautiously optimistic about that. So that is really good news, I think. So in the 6 cases from today so far, we have a spread of individuals less than 20, 1 person, the 20s, 2 people, 30s, 1 person, 40s, 1 person, 50s, 1 person. And the mix was 5 males and 1 female. So that brings our total number of cases to 509. And that is, of those 509, 291 have recovered, which means we have 57% of our caseload that continue to be open. So we have then a total of 13,006 negative test results overall, which means we have a 3.8% positive out of our total number of tests conducted for La Crosse County residents. 1 person is hospitalized, and we continue to have 0 deaths, and we're going to keep it that way. In Wisconsin, the total positives overall, 32,061. And that is an increase from yesterday to today of 484. So that is lower than some that we've seen in the last, like later last week. But our total tests are down as well. So the negative test results from yesterday to today are 4,802. And that's been higher in the past. And that is a 5.2% positive overall. 3,602 individuals are hospitalized in the state, 3,602 with 16 since yesterday. And we have 0 deaths from yesterday to today. So our total deaths in Wisconsin remains at 796. The percentage recovered in the state is 79% of the total cases that have been positive have recovered. So my message from that is cautious optimism about the numbers of cases not being in the 20s every day. Hopefully that continues. And the message to not let your guard down. So if you have made a behavior change, wonderful, keep it up. If you have not yet made a behavior change, and again, this is really about reducing risk. My primary message remains wearing a face covering if you're out and about, because that will help protect others in case you are early in your infectious period and don't yet know that you may have COVID. This happens to a lot of individuals, and we see a pretty significant percentage who are in the community before they realize that they're positive and can be spreading the virus. In addition, thinking about what we would say are the 3 C's, so closed spaces, particularly with low ventilation or poor ventilation, crowded places, especially with a lot of people, and close contact setting. So anywhere where you cannot properly physical distance. When those 3 are in place, the risk for developing COVID is really high. We also know that 4th of July events happened over the weekend, and we hope that precautions were taken. If they were not, then if COVID was spreading, we will see cases coming from that over the rest of this week and into next week. So again, the actions we take now help us to have lower cases in 1 to 2 weeks because of the time frame in which it takes to get symptoms developed and to get the test and to get the results of that test. Next, I just want to mention that on Wednesday, we're going to be talking about the launch of a new business recognition initiative. And this initiative is called Check the Spread. And it is aimed at being a positive way to recognize businesses that are following best practices. So it will allow for businesses to make a pledge to say that they are currently following best practices as listed and will continue to follow those. Some of the key practices in that pledge would include their employees wearing masks at all times and encouraging customers to wear masks as well. And masks here means for employees and customers, at least some kind of fabric face covering. And then also employees being required to stay home if they have any symptoms, and customers being encouraged to stay home if they have any symptoms. So those are important practices that will be able to recognize businesses if they are doing those practices. So there'll be a website, and we'll tell you more about that site on Wednesday. The public will be able to view which businesses have pledged already and as they pledge going forward. And there will also be an opportunity where customers can nominate a business for doing those practices and feeling really comfortable and safe in a certain business, as well as a way for them to email if they have concerns about a business. And then we can follow up and provide resources to that business to try to assure safety for employees and customers. So I think that's really exciting. And that is part of our overall strategy to prevent the spread of COVID-19 and the harmful effects that COVID-19 can have. In addition to that, we are working on another side of that, which is engaging the 20 to 29-year-olds in to be part of the solution with regards to decreasing the spread of COVID-19. So those are my updates for today, short and sweet, and we'll have more time for questions, and I'll take those now.
Go ahead, Dave from WKBT.
Oh, it's WXOW.
Yep.
Oh, yes.
Quite all right.
Yeah.
Thank you. Just nice to be here. Good friends at WKBT. Hello, Jennifer. How are you?
Good. How are you?
I'm doing fine. College students will return soon. Elementary, middle school, high school students back to school. Is it safe to do that?
Yeah, thanks, Dave. That's a great question. I'll start with the K through 12. So the K through 12 schools, the Department of Public Instruction, Department of Health Services have been working together to basically have guidelines as specific as possible for how they can be safe. Schools right now across our county and in other counties are working to take that guidance and figure out how to operationalize it. So on our team, Carol Drury, our environmental health and lab manager, who is the primary for business contacts as well, has been working with all schools in the county. They all meet every week and they talk through those guidance documents and how they want to operationalize them, which I think is really strong for our community and our county, because Their goal is to be consistent and to be as safe as possible for, again, all of the teachers and staff, as well as all of the kiddos that are going to be coming back to school in the fall. I think that they are looking at the Cooley COVID-19 compass and trying to plan in relation to what risk level we might be at. So I think that process is going very well. On the college side or higher education, as you know, we have 3 higher education institutions in our community. There has been a new strike team is going to be starting. I think the first meeting is next week to really get into the details about some of the planning efforts that have already been happening at these locations. So we've been working with them over the last 3 to 4 weeks. But we're really going to be digging in at the detail level soon. I do have concerns about that population just because we've seen our biggest surge here has been predominantly in that age group, and we need to be able to have really good plans in place. And they have to be, they have to be multi-factored with not just what the university and Tech and Viterbo are doing to prevent the spread, but also looking at the impact in the community, because what I think may happen is these students come back on campus and it may be activities they're engaging in outside of the actual school setting that increases the spread. And so that's a tougher place to get to, a tougher way to sort of control and prevent spread of COVID-19. And we're working some ideas there to include, I'm currently reviewing a proposal with the wellness coordinator who is not, she's only contracted with the university 11 out of 12 months. So we are thinking of contracting with her to try to get a group of folks together and understand what the barriers are to increasing mask wearing or changing behaviors in that population to help decrease the spread, and bringing some of those folks who are in that age group to the table to be part of the solution. So I think there's a lot of planning going on right now. And one of the other pieces is that we are in contact with Dr. Deo at the university there, who is the physician lead at the health center. And we are thinking of having teams of disease investigator, contact tracer, monitors at UWL, perhaps others as well, that can be part of our overall investigation team, but they would be employees of that institution and be able to be supported with the resources we can provide. And they can do the contact tracing and disease investigation with that age group and those that might be positive from a particular institution or campus. So lots of things in the works. I am particularly worried about the spread in that 20 to 29-year-old age group because of the trends that we've seen over the last 3 weeks. So we're going to do our very best to try to decrease that risk with those folks coming back to campus.
Jen, while we wait for other media questions, there was someone on Facebook who asked about an immunization and what your thoughts are when that might be available. I'm
assuming they mean the vaccine.
Yes.
So the only thing I've heard, nationally, I've heard that we shouldn't expect it until next year. But on the state side, we have heard that there may be a limited amount available this fall already. I don't have details about that. I have also heard that it might be a 2-shot vaccine. So there would be 2 injections required. I don't know what time frame apart. But if there is a vaccine that's available this fall, then we are preparing already for flu vaccination clinics. Hopefully we could work it into our process already for those clinics. If it's a limited quantity of vaccine, then it will likely come with directions about who can receive the vaccine, which I anticipate would be those that would be at the highest risk of severe complications from it, which typically are those that are immunocompromised with underlying health conditions and those that are older. So I will let you know more about that once we hear more. I've just heard some little blips on the radar about potential vaccine this fall, but again, no details yet. It's a great question. We hope it comes as soon as possible because that is the best way that we will get what we've talked about in the past with herd immunity, basically helping people have immunity to it without having to get it and develop the immunity naturally, which we don't yet know enough about anyways. We know that people can be exposed more than once, and if they are exposed and test positive a second time, that we follow it like we would normally with quarantine and isolation if they're ill. So we still have a lot to learn about this virus, and the sooner a vaccine can come, the less impact that we will see on health of our residents, as well as business and other aspects of our community, trying to get us more quickly back to an actual normal state, not a COVID normal state. So.
Go ahead, Dave from WXOW.
Sure, thank you. Jennifer, today there is a push for the CDC to make a greater announcement about aerosolization of COVID-19, but I'm struggling to determine the significance of that. It's something we've heard before, and it seems like a lot of factors would affect it. Could you help explain the significance of this announcement?
Yeah, so basically what this means is if they consider this virus to be airborne or aerosolized as opposed to droplets, which is what we currently consider it to be as droplets, what that means in general terms is that the spread is much easier than and much more difficult to control than in the droplet form. So we've talked about that droplets, can travel 6 feet. If someone is in an aerosolizing activity, for example, singing, exercising, yelling, those kinds of activities, then those droplets can travel farther. So what that means is if it truly is aerosolized, it means that those particles, those droplets are really small and they can float farther and can infect more, even when they're not in close proximity, like the 6 feet for a 15-minute increment of time. So what that impact is it really makes it more difficult to control the spread first and foremost. And it will be much harder to truly share risk level. Right now, we use very specific definitions of who is a close contact to a confirmed case. It makes it more like a measles situation in which, and again, I'm not saying this will be the case, but with measles, if you're in the same building as someone, you are considered exposed because it is on that aerosolized path. And think about in terms of long-term care facilities and hospitals, there are droplet precautions, and then there are more restrictive precautions for something that is aerosolized. And so it does have impact in the way that we are able to control spread, and it makes it much more difficult for us to control spread, and may require more use of PPE or personal protective equipment in a broader sense. So it could impact resources and other things as well. So we'll watch that closely to see what they decide.
Hi, Jen. This is Caitlin with WISM. We've had some people ask what the tests will be for the National Guard testing site on Friday, whether they're going to be the nasal swabs or what they can expect.
Oh, that's a great question. I actually don't know that for sure. I there are only two types of tests of these PCR tests. It's not the antibody. So it's not the blood test. It would be either the nasal swab or the nasopharyngeal swab. And we can confirm that, and we can post that on our website and on our social media site for you. I want to say in the past that it has been the nasopharyngeal, but we'll verify that for you. I'm sorry that I don't know that off the top of my head.
Hi, Jen. Same subject. Don't know if you'll have the answer, but do you know how many tests will be available kits-wise on the 10th?
Yeah, I do. I do have that answer, Haley. So it will be up to 400 tests that we can do in that day.
And Jen, can you just review for some of our Facebook followers what day the test is and some of those details?
Oh, sure. Thanks, Abby. So we have 3 testing sites that we're working on. The first one that's confirmed is at Logan High School. That's this Friday on the 10th from 10 to 6.
And I do have a quick question from John at WKBT. Can you talk a little bit about the daily testing gap that is on our COVID compass for epidemiology and what that really means?
Sure. So what that means is that we have an overall goal of how many tests per day that we're able to do in any particular jurisdiction. So by size, of course, there would be a certain amount of tests that you would want to do in each of the counties that are in the Cooley compass. So basically that is, the best number we can find in terms of, looking at evidence from a number of sources. So, and I don't have that off the top of my head, what number that is, but we looked at that very carefully when we first launched the compass as far as what would be the best goal for testing. So the gap just means of all of the resources for getting tests done for residents in any particular county, what is that number compared to the goal per day? And then that gap is the difference essentially. And the purpose of that is because a certain number of tests per day, there's evidence around that helps you understand the risk level in your community. So it's not like you want to be testing everyone, nor do you want to be testing no one. You want to be testing a certain number of your population, again, evidence-based, and we looked at a lot of different sources in determining what that best testing number should be. We talked to experts around the area, including infection control folks at healthcare system partners, and I think that's listed. It should be listed in the Cooley Compass. I don't have it up in front of me, but basically the gap tells you that you haven't met that target number per day. And that's the goal, is that you would be meeting that target number. So through your resources, whether it's healthcare providers, whether it's National Guard testing sites, if it's other folks that are testing, like if a business is testing, or if there are free clinics that are offering testing, every resource available, basically whatever that gap is between what actually is happening and how many you should be doing in a day based upon the evidence. That's what that gap number means.
And then looking at the COVID-19 outbreak and investigation page, I see we only have 5 establishments listed for high risk, which I know is significantly lower than we've seen in the past. Do you think that reflects some positive changes that community and businesses are making?
That's a good question, Haley. I hadn't really thought about that. I haven't looked at like the number that are on that list each day. I can tell you that the less we have on there, the less risk we have to the public and the community. So the high risk list is the most important one there, because it really does say we think there was a risk to the public. If you were in that location on that date, if there are times listed, often we don't get those from the cases, so it's just a date. Then we ask you to fill out that form so that we can be in contact with you and make sure that if anyone comes out symptomatic, that we're getting them tested because we think they may have been exposed. So it really is about, again, decreasing the spread of disease. And the lower number of businesses that we have on that list means that there are less potentially high risk areas where individuals may likely have been exposed. So comparing that to the medium and low risk categories, those really are not, those are to help us understand the risk that is in the community in total, but those are not locations where we are really concerned about individuals having been exposed to enough infectious virus particles that they may actually convert and become a positive case. Again, those are just more about the risk level in our community to help folks understand that when we say we have community spread, we mean it's in a lot of places and it will move around. So it's great that we have less businesses on that high risk list. And I think that we have seen lots of businesses. We've had a lot of contact with businesses, and I think my intel and my instincts would say that the between the communications we've had with businesses and the increased cases making vigilance higher in businesses in particular, most want to do the right thing. They want to protect their employees. They want to protect their customers. They don't want customers to feel unsafe. So again, it's this balance between being open, but doing it safely. And I think we have seen a lot of folks that even when we call them, if they're already doing a number of things, there's typically at least something that we can suggest that they consider adding to their list of precautions to help decrease risk to their employees and customers.
And Jen, another question from John at WKBT, back to the testing gap. Can you speak to how we're trying to remedy any testing gap in our community?
Yeah, so in terms of the testing gap, and John, if this isn't what you're looking for, please let me know that. But my biggest concern is the difference between, the CDC and Department of Health Services gold standard guideline now has been published as, testing anyone who is a close contact, even if they're not symptomatic. And I think the push is even to test others in higher risk categories that are not symptomatic. Unfortunately, we don't have the capacity to do that here in La Crosse County. We just had a meeting last Thursday, a really good meeting with both healthcare facilities, a number of folks at both, as well as the state. And we're making an ask of the state on in a number of areas to include, if we need reagents, and that's what's holding us back. The reagent is a part of the lab process. So after the specimen is taken, the test is conducted, the swab is done, the specimen gets to the lab. The lab has to use a reagent to do the test and actually run that to get a result. In one instance, part of our capacity challenge is in not having enough reagents. So we want the state, we're asking the state if they can help us get reagents to increase testing capacity. In addition, we want to be able to perhaps have more availability if possible through the National Guard, other than, these sort of one day every couple of weeks or a month. We're going to do a one-day testing event with National Guard 3 times between now and the middle of August. We are hoping the state will extend on state orders the National Guard, so we don't have to lose that resource in the middle of August. In addition, again, part of the capacity is because, or the lack of capacity is because we have so many folks that have been symptomatic, and we have a lot of testing that has to happen at long-term care facilities, congregate living settings, where if they have a case in that setting, they have to then test every 3 to 7 days, which means that can be a draw on resources that are available for other things as well. So all of those pieces really all comes back to, if we're all taking precautions and we're not exposing ourselves, we can prevent that exposure. Sometimes that could still happen, obviously, but again, if we're doing the face covering when we go out, we limit how much we go out. We're not in crowds without physical distancing and face coverings. we're going to decrease the need for testing because, you know, we have less people that are becoming symptomatic and really need testing. So it starts with behavior change at the individual level and the business level to decrease risk. And then it also includes increasing capacity with some of the other things that I mentioned. So as with anything, there are a number of ways that we can try to improve that. And we're pushing along a number of those ways to try to increase capacity. It's definitely a goal of ours. We don't want to not have the ability to test people, particularly close contacts who are not symptomatic. We want to be able to test those folks. And so we're working really hard to increase capacity. And just a reminder that even if you are a close contact, you're not symptomatic and you get tested and your results is negative, doesn't mean you can get out of the quarantine before 14 days. And that's scientific based because it can be that you didn't have enough virus yet replicating to make the test turn positive. And at the end of that 14-day quarantine period, that result might be different. So even if we do get to that place, just know that we still need to quarantine folks, but at least then it helps us know if we've got a case instead of a contact, we can get more quickly at that person's contacts and try to decrease spread.
Do we have any other questions for Jen today? I don't think so, Jen.
Okay, well, just to remind you all that the numbers look really good today so far and over the weekend. I'm hoping those hold and that we took precautions over the weekend. If we didn't, we'll see potentially cases coming in over the next 2 to 14 days from the weekend events. But again, I'm cautiously optimistic. Keep doing those behavior changes. If there's more you can do, again, while it may not be super comfortable to wear the face covering, it is so critical to prevent spread. And we'll be able to really get on top of cases if they're not coming in so fast and furious. Our goal is to take those cases back locally and not send them to the state. I think that will be a huge benefit for our community because it gives us a chance to do the process more quickly, connect with people where folks may have not gotten quick connections because of the vast volume of cases that were coming in. So we like to see the case numbers low. That helps us in a lot of ways be able to decrease spread. So keep doing all of those good precautions. And if you can make an improvement, please go for that. And thanks so much. We'll be back on Wednesday. And again, we'll talk about the business recognition program and other updates as well. So thank you. Have a good next couple of days and try to stay cool.